Yep, I think. Yep.
Well, good evening, everybody. Welcome to Fertility Fact or Fiction. I am your host, Dr. Rahi Victory, a double board certified reproductive endocrinology and infertility specialist, and off camera currently desperately trying to get TikTok to cooperate because both our stands for our cell phone decided to croak on us, is Tariq Ibrahim from Ibrahim Strategies Group, my dear friend and guy for all things social media. That is not going to work. I don't know what you were thinking with that one. Tonight, we actually have a special guest with us, but I'm going to give you some backstory. So we are very busy here at VRC, and we needed to cut down wait times because currently the wait time is very long. And I knew that getting someone that I could train like me is difficult because getting another doctor, they come with their own sort of wants and desires and ideas and philosophies. And I kind of want more mini-me's. So what I needed was someone that would learn from me and get trained. But then if you want someone that can also do procedures, that's not something that just everybody can do. You need someone who is skilled, who is knowledgeable, who knows how to do things, and as well, ideally has some background skill in this kind of field. In particular, we do an enormous amount of ultrasound. So we're doing ultrasounds when we're doing transvaginal things. We're doing ultrasounds when we're doing the transabdominal approaches, whether it's for egg retrieval or for embryo transfer. And I'm sorry, I'm laughing at Tariq because he's lost it right now. And so I basically needed to find someone that was really skilled at being able to do all these things that we needed. So I got extremely lucky and found an incredibly wonderful person who is incredibly smart, very, very committed, very dedicated, and is currently a physician assistant. So she could train and learn to do all the things that I do and take over some of the patients, but also previously was an ultrasonographer. So I would be very happy to introduce you all to one of the newest members of VRC. In fact, I think you are the newest member of VRC. No, Michael. Michael is the newest member. The second newest member of VRC, our wonderful, incredibly talented, very lovely Stephanie Horvath. So welcome.
Thank you. Thank you. Thanks for having me.
Yeah, it is so good to have you on board. So tell us a little bit about you. Where are you from? What were you doing before I stole you from them?
So born and bred Kingsville. So have grown up there my whole life. You stole me from orthopedics. Sorry if they're watching. But no, I'm super happy to be here. It's been a wonderful experience so far.
Awesome.
The VRC family has been very, very welcoming. And I've really enjoyed the medicine. So it's just been absolutely fantastic to be here so far.
That's great. And you were with the orthopods before doing orthopedic type stuff, procedures, consults, visits, all that stuff.
All that stuff, yeah. Mostly heavily based on consults and follow-ups and then some ultrasound guided injections. So I was with them for, since my graduation, just over 5 years.
Wow. So what drew you to the world of infertility?
Well, I've always had a very special place in my heart for women's health, obstetrics, gynae, and fertility. I know a ton of friends who've gone through it. I've seen them go through it. I have family members who've gone through it. So I think more awareness is needed, and you are obviously incredibly busy, and I've heard that from a lot of people who needed help. So I thought with the ultrasound background, it would just be a perfect fit to kind of mesh my way in here and become mini you.
Awesome. Pull the mic probably a little bit closer to you. Yeah.
I'm not loud enough for one.
You're probably loud enough, but yeah. So what do you love about this work now that you're in the midst of it and you've been with me for a while? And I got to tell everybody, she is a spectacular quick learner, like just incredibly fast, has picked up everything, the microbiome stuff, the immune stuff, the egg retrievals, the embryo transfer, just lightning quick. So I am very, 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 very pleased that Steph is with us now. But what do you love most about it?
I think you just answered it because it's the variety.
It is.
Yeah, I absolutely love the variety. Being in and out of the OR and then seeing patients. My microbiome and immune has been very interesting
Yeah.
to learn, and something honestly I knew nothing about prior, and I've seen the importance of it. It's very challenging to learn, but I've really enjoyed it. And I really like it. I'm now starting to see patients back
Right.
that I've been here for quite some time or a little bit of time. So I'm getting to see that repeat. So it's nice to follow them through their journey. And I think that's what I'm going to enjoy the most.
What do you think the challenges are in doing this?
There's a lot of challenges in doing this. Challenges in the OR for sure.
Sure.
So everyone's anatomy is different. So that's been already very humbling being in there.
But you're going for even the tough eggs now. I mean, I watched you do it today, and I was like, okay, she's really feeling confident, which is amazing because a lot of the resident was standing next to me, and I said most people would not have gone for that. So I was really excited because not only are you good at it, you're actually getting great at it, which is phenomenal. So I love that.
Yeah. Channeling Dr. Victory. So.
Well, yeah.
Yeah, mirroring you, clearly taught by you. So I'm going to go for it.
There you go. I like that.
I know when to stop.
Yes, you do. And it is delicate. I mean, you got to learn to thread the needle just right.
Yeah, there's quite a technique there, and obviously still learning that technique, and we'll continue learning, but I've enjoyed it so far for sure.
I think some days I'm still learning. So there's always, a challenging case here or there. Very, very cool. So we are integrating you into mainly the fertility part of things. You're now very comfortable doing consults, visits, returns, like the I1 as we call it, so the first follow-up. And you're basically going to be building up, seeing a lot of the patients even before me. And so far, I've heard nothing but raves from everybody because even the fertility coaches that we work with say, like, basically, it's just like talking to me, which I love. So I think that's great for the patients because the patients are always worried that if they don't get me, it's not, the same. But when you get Steph, you're actually getting me, which is amazing. So I love that as well. And tell us a little bit about you. You have a little baby, right?
I have a little baby. He's 19 months old. Name's Callan. He's fantastic, other than he does not sleep.
Yeah.
So we're working on that. But his speech has exploded. He goes to daycare while I'm at work. He's doing much better at daycare. So I saw a picture today. He was holding his friend's hand. Apparently they were going for a walk in the play yard together.
Oh,
He
very
was
nice.
telling me about that all evening. Yeah, going for a walk.
He's very chatty now too,
He's very-
right?
Yeah. He stopped talking.
Well, that's
Might
good.
have a little bit of me.
Do you have a favorite thing that you do with us already? Is there something you love the most about what you do here?
I do.
Okay. Is it?
Embryo transfers.
Oh, really?
Yeah.
I would have thought it was the egg retrieval. Wow. What is it about the embryo transfers that you love?
The egg retrieval would be a close second.
Okay.
I like the embryo transfer one, the patient's awake.
Yeah.
So that's
Easier.
nice.
Yeah.
A little bit easier. But it's kind of not the start of their journey, but like the exciting part where they're very, very hopeful. Whereas the egg retrievals, I find sometimes people are more stressed and anxious because they may not know the outcome. But the egg retrieval would be very second, just because I do enjoy a challenge.
Do you think that you're going to feel comfortable enough to start doing the IVM egg retrievals?
No.
So just for everybody that's watching, the IVM egg retrievals are a very, very challenging case. So yeah, I don't know that too many people are going to brave that one.
That's what you think.
It's a me thing.
Yeah,
I
I'll
agree.
leave that to you.
Well, thank you for coming on. I wanted to introduce you to everybody. So folks, if you are coming to VRC, you may see Stephanie. She is absolutely spectacular, kind, wonderful, compassionate, empathetic, super intelligent, very hardworking, way more organized than I am too. We can say that. Yeah, I will admit my flaws. And so we are very, very pumped to have her here. So thank you for joining VRC. Our latest and greatest edition, and we will look forward to having you on the show again, maybe in a couple months, to tell us about how many people you've gotten pregnant and all the success stories and the tough cases and stuff like that. So thank you for joining us tonight.
Thank you for having
Big
me.
round of applause for Steph. Yay. Thank you.
Thank you.
Have a good night, Steph. We'll see you.
Guys too.
All right. See ya. You coming back on camera there, Dr. T?
I think you can keep me off.
I don't think I could keep you off if I tried. Thanks, Steph.
Thank you.
Okay, so for tonight, we have a good night. We have a topic that I wanted to discuss because there was a case I managed this week that I think everybody needs to be aware of. And this is a very interesting case because it A, blew my mind, and B, kind of gave me a little rage tendency because this patient did not get the level of care I believe she should have received. I won't blame anybody else, but just, what I think is appropriate. And she had previously seen 11 different doctors and no one detected this. So I want to talk about this a little bit because people always question stuff. And I think it's good to question, but by and large, everybody in this field is doing their best to do a good job and help everybody out and make sure it works. And sometimes it does, and sometimes it doesn't. But I wanted to, make this kind of be good for everybody. So are we still sharing?
Yeah, you're good.
You got my video?
I do.
Okay.
I already did 2 6.
Perfect. So is it playing right now or not yet? Okay. All right. So this is a middle-aged woman, very healthy, very fit. She's from the United States and she has nonstop problems with the lining of her uterus getting thick enough. She does unfortunately succeed once, but then suffer a miscarriage and had a couple of other failures and transfers, and has seen 11 different specialists, including people that operated on her and had actually done hysteroscopy on her. And no one ever commented on the shape of her uterus. So I ended up looking at images of her ultrasound HSG, and I said, that's not normal. It's completely abnormal. You have a super T-shaped uterus. There's no way this is going to work. And keep in mind, this is someone who has had chronically thin endometrium. They could not thicken the lining of her uterus. She actually had to use a surrogate. And so I said, let me take a look at this and see. So I'm going to share some images from hysteroscopy I just did for her because I think it's valuable to learn this. So we're going to show you a picture. T, you got it set up there?
Ready?
You're ready. Okay. So I'm going to go to here and I'm going to choose some type of pen that I can use and see if does that squiggle? Yeah. Okay. So I'm going to blow up this picture, which hopefully will blow up enough. Is that good? You can see that nice and large on your screen. So this is a hysteroscopic image, and am I on the screen as well?
Yeah, you sure are.
But is my picture on the screen?
It sure is.
They're both on the screen. Oh, I'm down at the bottom. Okay, I love it. So this uterus is all white. It's like a tunnel, and it's a very, very, very narrow tunnel. That is roughly the size of my Apple Pen. Okay, that's the same size. So that's that tunnel that you're looking at, because my camera, which is filling that whole tunnel, is only 7 millimeters, 6.5. So it's roughly about the size of this, maybe even honestly a little bit smaller than the size of this pen. That was her whole uterus. And then if you look, I don't know if this Apple Pen will work, but no, it's being a bugger. So if you look here, right, just up in there, that's the actual cavity of the uterus, the red part. The red part is the cavity, and that's all that there was for a cavity to her uterus. No wonder she could never get pregnant. The uterus is like this big. It's insane. So then I actually said, okay, none of this makes any sense. So let me just slide over images here. So then I looked at another picture. Here's another one. You can see it even longer and better. Just a straight tunnel. It goes right up to the top. So this instrument that I've got in there is called a Collins knife. So you can actually use this to operate. And if you look in this picture, this here, I'm getting that. Whoops. So if you look at this image, this here is the opening to a tube right there. Okay. So that is the opening, and right there. And then there's one on the other side as well, but you can't see it in this picture. So I was like, oh my God, this is the craziest uterus. It's so tiny. You only have, if you look here, from basically here to here, and from there to over here, that's the whole cavity of the uterus. It's like less than a centimeter. It's so small. There's no way for an embryo to implant in there. They never would have even gotten it into the right place unless they parked it at the top of the uterus, which you're not supposed to do. So what did I do? I took this uterus and I reshaped the entire inside of the cavity so that she had an actual normal cavity. So by the time we were done, it's no longer just this tight little tunnel. I widened the sides. I shaved off even the top to let it breathe and expand a little. And now you have an actual almost normally shaped uterus. It's still very narrow, but it's way better than it was. And now at least this uterus is going to develop some endometrium and grow because we've recreated an entire surface. This is why her uterus would never expand. It was so tight, it couldn't actually develop a lining. And she was paying thousands upon thousands upon thousands upon thousands of dollars for this treatment. So people have to understand that when they go to a fertility center, you need to find someone that genuinely cares about your success and pays attention to every detail. Last year, Tarek and I showed pictures on a clip of a absolutely clear as day septate uterus with a massive septum that no one had ever addressed and taken care of. And she had failed 5 different embryo transfers. This is essentially no different. It's virtually the exact same thing. People that are going through this need to understand that they need to get appropriate holistic care. I think TikTok was looking at nowhere for it was looking at me on the side. All right. So that's my rant for today. Make sure you get good care. Nobody should have a uterus like this. And we can stop screen sharing, but I'll take your questions. And I know we went a little over time there, but there it is.
Yeah, I already stopped screening. You're good.
For some weird reason, oh, that's the time I took that photo. Okay. Okay, go ahead. I am ready and all ears.
Okay. Well, Dr. Victory, I'm back.
There you are.
No.
Welcome back, Tarek.
Yeah, thanks. Scrolling for questions. How long do you need to take progesterone suppositories for an FET?
Well, studies suggest that for a day 5 embryo, you should be on it for 5 days. And for a day 6 embryo, you should be on it for 6 prior to the embryo transfer. So if you started Monday, you'd start Monday, Tuesday, Wednesday, Thursday, Friday, and then you would do your embryo transfer on Saturday. If it's a day 6 embryo, you would do it on Sunday.
King T and Dr. V. Chemical after my first FET with a medicated cycle and lutron suppression. Do I do another medicated with baby aspirin, Pepcid, and Claritin? What do you suggest?
Well, Pepcid and Claritin have absolutely no evidence. No one knows if they work or not. So there is no proof for Pepcid or Claritin. Medicated has the lowest chance of success and the highest rate of miscarriage. So that doesn't make a ton of sense. So I definitely wouldn't be doing that. Yeah.
Dr. Victory, if a failed FET right after a lutron suppression, is it okay to go into a lap?
Into a laparoscopy? Yeah, absolutely.
Is this diffuse adenomyosis?
Is what diffuse adenomyosis? Did they send a picture or something?
No, they just said this. Is this?
I don't know if this is diffuse adenomyosis. There must be more to that question.
As of right now, there is not. We'll continue. Hi, Dr. Victory. I've had 2 retrievals with 2 clinics.
Okay.
14 eggs and 5 embryos.
Yeah.
From the first, 1 baby, 4 failures, and 4 eggs, and 1 possible embryo. Won't know until this weekend.
Okay.
All my sonos, biology.
Is there a question?
No, monsieur. There is no question.
Oh, okay.
Just sharing the info with
Well, thank you for sharing. I need some context there though.
Yeah, you sure do.
Yeah.
Dr.
Next.
Victory, hi, fabulous fertility gods. Wow.
Oh, yeah, no. I can't do that. No blasphemy, please. Yeah.
Just turned 35. DOR, endo, egg
Okay.
freezing. What can I do priming wise to get higher follicle numbers Neupogen or rapamycin or something else?
Neupogen works. Rapamycin works. DHEA can work. Testosterone can work. Human growth hormone can help. Those are the ones we use, and we actually use all of them at the same time together frequently. So we're pretty comfortable with that. I cannot believe you put my cell phone in what is that, a cookie jar, a tea bucket?
Tea bucket, yeah. I saw it when I was making tea, and I said, you know what? This will hold.
If only these people could see it. Maybe they can't. Can they see it on your camera?
You think I'd let them see that?
No, they can't. I can see it on the screen.
Oh, yeah. No, but it's not in the. Oh yeah, it's actually in the.
It's in the frame.
My precious. The horse not here today.
I see that. Yeah, we lost the horse and my stupid
For
tripod.
what it's worth, I'm pretty sure I left it at our hotel that if I called them, they'll get it back.
Oh yeah, it's gone, buddy. Yeah,
Do you want to hear a hotel story?
not in the middle of the show.
Guys, I tried. It's a good one. It's a good one. But okay. All right.
Well, you can ask the audience if they want to hear a good hotel story. Strictly not OnlyFans type hotel story.
No. During Ramadan, nothing like that could ever happen. It wouldn't be appropriate.
Or outside of Ramadan,
Or outside of
because we're
Ramadan,
both
of
married
course,
men.
of course. But for the story time, for the excitement of the story.
Yeah.
You gotta
Build it up a
yeah,
little.
what are they up to? Nothing. We're just in bed sleeping. Nobody's that exciting. I don't want to admit that. Our ratings will plummet.
Our ratings, we're ordinary people. Yeah.
Hi, Dr. V. I was diagnosed with one subserosal focal adenomyoma via MRI.
Okay.
Will this impact IVF outcome 38 years old?
Depends on the size, but once you have adenomyosis, it's very common that it impacts IVF outcome.
Want to unplug your iPad charger?
Sure.
Let's launch it. No.
Like toss it off.
There you go.
Okay.
Much better.
Oh, it was showing up.
Oh, there's a lag in TikTok. I never noticed that. There's like a good 3-second lag in TikTok as well.
Oh, there you go.
Dr. Victory, do you recommend suppression prior to an FET if only very mild perineal endo was found and removed 3 months ago?
It's probably peritoneal.
Peritoneal.
Yes, I do.
See how hard it is to read?
Do you recommend suppression prior to FET if only? Yeah, that's hard to read. Yeah.
This table's not working for the TikTok live.
We need like a black drape.
For sure. This is. It was in your pen at the beginning when I was reading it, and it was gone.
I feel you. That's tough. I don't blame you on that one.
Are we supposed to be seeing this image too? No. They're asking if they could see the TikTokers.
Oh, the TikTokers? I can show them.
Okay.
TikTokers, here you go. Hang on. Here. Sorry, guys. I want to show you this. Can they see that?
Yeah, they can absolutely see that.
So that is what I saw. Yeah, that's perfect. That works really well. So it's just a tunnel. Yeah, it's just a tunnel. And oh yeah, there is a big lag. And it's just like there's a tiny little bit of endometrium up at the top, and that's all there was. So that was the tunnel. And then when I actually fixed it, it looked like this. I'm watching myself 3 seconds behind. So way, way bigger. And you can see that inside there, the entire cavity has been expanded. It's widened at the sides because I had to cut at the sides. And I even trimmed the top to level it out because it looked like there were a little bit of a Y tendency to it. It was going up into the corners. So I had to actually shave everything and expand it. And now this uterus actually has a chance. Prior to that, it made absolutely no sense. It was bonkers. Anyways, that's the picture. Yeah, fire away.
Hey, wonderful doctors. What day to start Lovenox in the transfer cycle if only positive for PA, Pi, 4G, 5G?
Well, for Pi, you shouldn't be using Lovenox. You should be using old-fashioned heparin because low molecular weight heparin doesn't work for Pi. And you should start it at least 1 day before the transfer.
If you don't have endometriosis, do you still take Lupron before an FET?
Yes, we do, because studies show that improves your success rate.
Any more success with in vitro maturation? I'm 49, going to be in your clinical trial.
We are getting very good egg quality, but we are getting variable outcomes in terms of the blastocyst development. So it's still in the works, but we so far have only had 7 cases. So it's starting to ramp up a little. We're trying to do 2 or 3 a week now, and hopefully soon 5 a week. So we're going to be getting through everybody. But at the moment, it's looking like we are correct that we can really improve egg quality, but getting the blastocysts and embryos to develop well is a different story altogether. It's coming, and we're getting some really pretty embryos, but not for everybody. Keep in mind, the patients we're using are the toughest cases. These are all people that have failed conventional IVF before.
Do you find the COVID vaccine has led to infertility and even miscarriages?
No, that's been studied extensively, and anyone telling you that it does is lying to you. There's absolutely not a shred of evidence anywhere to demonstrate that the COVID vaccine led to any impact on fertility or miscarriages. In fact, the data is very clear that it did not do that. How come it's like disappearing?
It's switching to 3.
By itself?
Mm-hmm.
That's weird.
I'm noticing. Hello, wonderful doctors. How many days do you recommend abstain from DNA fragment tests? My clinic is saying 3 to 7 days, but that seems long.
Oh, like how long should you abstain before you do a DNA fragmentation test? 1 to 2 days.
Also, ask how many days do you recommend abstain? Oh, we did that. Okay. Dr. Victory. You already responded to my DM regarding the FET protocol with daily progesterone versus every 3 days, but I would like to know if the results are similar.
So there's a study by a clinic that's very well known in the States called Shady Grove. And Shady Grove compared vaginal progesterone plus injectable to vaginal progesterone plus injectable once every 3 days. And they showed that there was no difference in the outcome.
Dr. B and Dr. T, what transfer protocol do you recommend post-hysteroscopy for Asherman's history of thin lining and adenomyosis?
Well, those patients are generally going to need more estrogen. So that is a case where you probably need some estrogen. But if you can get the lining to grow with an anti-estrogen like tamoxifen or like a transdermal estrogen, if you have to use some estrogen, or maybe even letrozole, that would be best, because that's always going to be best. But Asherman syndrome patients are going to need some estrogen for sure.
Just a hello. Thanks for being the greatest dogs on IG.
Oh, that's really sweet. You got to love that.
I do love that.
Mm-hmm.
Guys, I just want to share this little candid commentary here. This is where I go to feel like a human. Come to my house, destroyed, dismantled. I come here.
Well, at least you got lots of kids at home still, and a wonderful, loving wife. I got the loving wife, but the loving wife loves the cats more than anybody, including me. Yeah. The other night, I'm ready to go to sleep. I want to, be the big spoon. I go to roll over, and the cat is sitting on top of her, and she's like, "Who's my handsome? Who's my?" I'm just like, "I'm the handsome. Like, it's me. It's me."
You are the handsome.
Yeah, but no, I wasn't, because it was the cat. I'm the spare. If anybody else out there is the spare, let me know. We can commiserate, because I am the spare.
Thoughts on Fertile Pro supplements for a post-cancer treatment, 35-year-old male?
Yeah, great. We love Fertile Pro. They have good products. Use it.
34-year-old, 2 IVFs. 34-year-old, 2 IVFs, one with 2 embryos, both miscarried at 11 weeks. Second had 8 embryos, endo, adno, lapro.
Lapro?
Laparo.
Is it like a question mark after the
Yeah.
lapro? Oh yeah,
Yeah.
of course. You need laparoscopy. You need our endo adeno protocol for sure. High dose progesterone, immune protocol, letrozole, Lupron and letrozole suppression. Avoid estrogen at all costs. Lots of natural supplements, anti-endo. Get surgery, get it all removed for what you need to. Absolutely, makes a night and day difference for people.
How do people usually feel on your endo protocol?
Horrific. It's awful because we're suppressing you for 3 months. I warn everybody, it's absolutely savage. It is not a nice thing to do to a woman. Not nice at all.
How to improve from a oligospermia condition?
Oligospermia condition, vitamins, supplements, Clomid, HCG. If it's indicated, you need to have a hormone check. Lots of vitamins. Ejaculate every day or every other day. Keep your testicles cold. No smoking, no drinking, no drug use. Get an ultrasound. Rule out a varicocele. Those would be the mainstays.
Dr. V.
Yeah.
I need to share after 3 ectopics, my 4th and final FET work with 100% natural protocol.
That's awesome.
My old clinic refused to let me try, so I switched clinics and so glad I did. Thanks always for the advice.
Oh, that's fabulous. See, I love that because we didn't even see this person probably. And she got pregnant just because I told her, don't go back to a place that just keeps endlessly doing the same thing. It's mind boggling. It's absolutely mind boggling. Like this poor woman that I showed the pictures of, like she had spent, I don't even want to tell you how much money she had spent. And no one could figure out why her lining was so thin. Like it took me 3 seconds to look at her ultrasound and figure out why her lining was so thin and it couldn't thicken. She literally had no uterus in there. And I didn't even need to operate to figure that out. Other people had actually been in that uterus with a camera and told her, no, it looked normal. There was nothing wrong. She did have Asherman's before, but what I saw in there was not Asherman's. That was just like the world's most narrow cavity. She needed massive resection. She sent me this wonderful note today thanking me for everything. But, you know, it's infuriating for me. Like, how can people be, I don't want to say taken advantage of, but how can other doctors not pay attention enough to the details to get it right for that patient? Like, those are embryos. They're precious. They have, you know, potential to be tiny little people. And to just say, oh, try again. Like it literally, to me, that's like belittling humanity. You're just ignoring it like it doesn't matter. That is not okay.
What is the deal with it? Do you know? Like what is the actual reason that you think?
You're blank again. Yeah.
That you actually think it's so, I don't want to say so common, because I'm sure there's plenty of great docs out there. We'll make that assumption. But like when that picture, that's a serious picture, right? Everyone saw it today. There's nothing normal there, right? You look at it at the before and the after, very dramatic. And she said she went to 11 different doctors.
11.
I don't know. That sounds crazy.
It's insane. Like it just doesn't make
11
any sense.
doctors in a row. What's being implied here is that you went to 11 doctors in a row, and no one looks. Is that
so I could understand if no one looked. People were actually in her uterus performing hysteroscopy and told her no, it looked fine. Like there's no way she was getting pregnant with what she had. There's no way. It would not have happened.
Oh, wow.
There's no space for that uterus to expand. Like it was just a solid tunnel. And with like this much endometrium. I mean, how can that possibly be functional? There's no way. She needed a huge amount of work. Like even for me, I was like, whoa, this is going to be tough. And I spent Normally it takes me 5 minutes to do one of those cases. I was in there like a good 10, 15 minutes, just like reshaping and nicking and making sure I didn't go too far and making it perfect and smoothing out the edges and all that stuff just to get a good final view of everything. Crazy.
And she came here from the States.
She came to freezing cold Canada all the way from Florida. Yeah. And she brought a key lime pie that I still owe you. So where are you going to be tomorrow? How can you not be at the store? You got to go to the store so we can deliver the pie.
I'll come just for the pie.
Yeah, just go for the
just
pie.
come here if that's the case.
I'll bring it here.
Bring it here.
But you got to come. You got to come early because the.
Yeah, I know.
I'll meet you early. Yeah, we won't go over that, but we know. Yeah, we know.
Master T and V.
Yeah.
You suggested not to do medicated. So which protocol after my chemical coupon should I do?
Letrozole
There you go.
or natural, but never medicated. Medicated after suppression makes absolutely zero sense. No one should do medicated after suppression. It's bonkers.
Dr. Victory.
Yeah.
Hello, Dr. T and Dr. V. I appreciate
The doctor call out. Yeah.
That's always good. I have a 2-centimeter endometrioma, which was found on imaging. No laparoscopy. I have 2 losses, no living child. I don't have heavy bleeding or menstrual pain. Is my endometriosis contributing to my situation?
Yes.
Just like that.
Yeah. I mean, endo is always going to reduce your chances of success. There's no question. We know that it does. That's just a given. Absolutely, it does.
Do you know, is there a threshold in which endometriosis doesn't affect?
No, you can have one spot. In fact, I looked this up recently. Between 4 to 7% of patients that don't even have visible endometriosis when you operate, if you just randomly take biopsies, they will still have endometriosis.
Oh, wow.
So there are people out there, even when you operate and you look and you go, there's nothing there, you probably should take some samples and send them, because some of those people will come back positive for endo when they look at it under a microscope.
And then it'll make it difficult to get pregnant.
Absolutely.
Wow. But you don't actually see it. So small endo.
Microscopic.
Microscopic endo. So
It just
even if
hasn't.
It's not physically inhibiting, it will chemically inhibit.
Yes, because it causes inflammation and kind of inflames everything. Mm.
Interesting. I thought it was always physically stopping stuff from happening.
No, it can be mechanical. It can be immunological. It can be a direct effect on egg quality, egg maturity. You get fewer mature eggs when you have endo. Embryos, implantation, endometrial receptivity defects. It's everything.
It's everything. That turned out to be a pretty good question.
That is a good question. Yeah. Yeah.
Go V and Majesty BFF Dr. T.
BFF Dr. T. Majesty BFF Dr. T.
This is all good. This is my favorite person. And you know what? She swings hard with the intro. She really does. She does a great job.
All right.
Great job.
Love it.
My DHEA is 467 mcg over DL.
Okay. I'd have to convert that, but fine.
I start luteal stims next week.
Okay.
Is this DHEA too high? And what is the optimal range pre-stim?
I'd have to convert that into our units. You don't want to be too high over the upper limit of whatever the microgram per deciliter function is. But you want to be reasonable. So, you can go up to like even 50% above the upper limit of normal, but you don't want to be like quadruple, triple, that kind of thing.
Nobody wants to be quadruple or triple.
Yeah, that's too high.
Too much. Hi, my favorite bromance. See, now we're getting really good stuff.
We do love each other.
Absolutely.
Yeah.
How common is a chemical pregnancy with euploid embryos? Does this indicate further issues, or could it still be the embryo?
It could still be the embryo, but it would be very likely that that's either a microbiome problem or a uterine cavity problem or an immune problem or DHA, or a DNA fragmentation problem. Yeah. So there are things to look at there before you commit to an answer or a question.
Dr. V and Dr. T, can you do a hysteroscopy while suppressing on Lupron?
So I've been asked this many times recently. So I looked it up. The data does not support that there's a significant impact. However, no one's actually done a properly done study. So there is no really good data out there. But if you just think about it physiologically, we know already that people with thin endometrium are the ones that scar the most. So operating on someone with thin endometrium makes absolutely no sense. Who's going to have thin endometrium? Someone that's suppressed. So do I operate on people's uteri when they're suppressed? Only if I'm putting a balloon in afterwards to keep everything apart from one another.
All right, back on
Tickety talk.
tickety talk. So Arthur, really? I feel old looking at my phone when I'm reading on TikTok. Hey, I'm just gonna go with that. Hey, thoughts on adrenal suppression? Someone got pregnant naturally but miscarried.
Yeah, I would still do it. That thing's really possessed.
Yeah, straight up, right? It's going nuts today.
I
don't know.
know. Maybe is it the auto? Take it off of auto.
There's no auto.
At the far right.
All right.
The button that says auto on the far right. Yeah.
I don't know what that is. But that's probably always on like that.
All right. I don't know what's wrong.
I don't know why it's
It's possessed currently. Yeah,
straight voodoo going on here, guys. We got a ghost again.
we do. We got a ghost in the machine.
I'm nervous in the first steps of this journey. AMH was 0.47 and I'm 43.
That's a low AMH, and you will need to focus on trying to make as many eggs as possible. You also need a long discussion because it will take multiple tries in order for you to be successful.
If in early menopause, can someone try in?
It's off again.
I see that.
Why is it doing that?
I don't know.
Is something plugged into input 3?
No, that would be the most obvious answer. That there's something plugged in and it wants to go and share. No.
It's really just constantly flipping to input 3. Okay, so ask the question again. If
The
someone
question
what?
is,
Yeah.
if in early menopause, can someone try in vitro maturation?
Yes. You can. That's kind of who we're testing it on, actually, to see if it works.
37-year-old, 2 retrievals, 16 mature eggs, 14 fertilized, 15 embryos, 1 PGT normal. Do I have an egg quality issue?
How old was she?
She was 37.
I don't know if it's an egg quality issue or a lab issue. I mean, I would have expected at least one more euploid embryo from that many eggs. So it could be an egg issue. It could be a sperm issue. It could be a lab issue. You have to go over it with the lab. Here's another gripe. Okay. I got a report from a patient the other day. They contacted me from another city and they said, we got all these eggs and we only ended up with 1 embryo. I said, well, how is that possible? And then they said, well, we don't know. And I said, what do you mean you don't know? I love these stories, right? Like, how can you not know? Did they not review?
My favorite stories.
Yeah. Did they not review the case with you? No. Well, did they tell you there was a problem? They said, I must have an egg quality problem. I said, okay, show me the sheet. In her sheet, which it took us forever to figure out, okay, in her report, it says egg quality fair. Like it literally says fair quality eggs. So they told her it must be an egg quality problem, but the embryologist actually wrote fair quality eggs. So which one is it? And they never told her. The doctor told her she has an egg quality problem, but the lab, they never reviewed the lab. So when we do a report or a review of our cases here, and I'm explaining it to patients, I literally tell them, you had a sperm issue, your morphology was bad, the sperm was low count, the motility was whatever. And for the eggs, I'll tell them like dark center, granular cytoplasm, vacuoles, large paravital, like all these egg quality metrics. we literally tell them every single one that's there. And then I review how many they got, how many were mature, how many we matured for them, because we do that routinely, how many we managed to exceed. Like I go through every single thing. Everybody else, I ask them these questions. They're like, I don't know. Yeah. You remember Alex Murphy Klein from the UK? No clue what had happened to her in her first cycle. And they sent her an invoice for her next cycle before they even talked to her about why she had failed the first. No clue. She had no idea what had happened. Like that kind of care is just atrocious. It can't continue.
Yeah, it can't.
No.
That's the whole point.
We need a way better system. Yeah.
Crazy. How often are you at the Sarnia location?
Once or twice a month. And Steph's going to start going there as well, or doing it virtual. So, yep.
Dr. Victory, if in early menopause, can someone try?
Yes. Yeah, we answered that one.
I have 18 untested embryos in the freezer.
Oh,
I'm 36, 4 failed FETs. Should I thaw and test embryos?
no. You should test your microbiome and your immune system first. There's no reason why you would fail 4 embryo transfers. There's no way they were all genetically abnormal. Statistically, the likelihood of that would be negligible. So no, don't do that.
Does expanding the cavity create scar tissue?
It shouldn't, but I put a balloon in her so that it can't.
In a modified natural FET, better or fully medicated FET, and why?
That's just driving me crazy.
I have no idea.
You got to find a button. What about the top and bottom ones? It's not that. It's just annoying as hell.
Yeah, it's absolutely insane.
It's not the ones that are lit up.
No. It's meant to be an effortless thing that I pick you or I pick me.
Yeah.
It stays with it because no one told it to go otherwise.
What about the handle? Maybe it needs to be down.
No, that might transition into one of these things.
I don't think so. I think that takes it down between you and me. Try it.
Did nothing.
Well, let's see if it leaves it there.
All right. It's
Maybe-
now. Oh, it switched to me automatically.
It's on some kind of auto. You got to get it off of auto and put it on manual.
No one's on 3 though.
It doesn't matter. It's just circulating between the 3 inputs. What's the off? Is there an off above auto, or does that say cut?
I don't even know what you're seeing. This here?
Yeah.
No, this is just cutting auto.
You got to turn that auto off. That's the problem, man. Anyways, it's got to be the auto. Nothing's working there, right? I know. It's just so infuriating.
This is the worst thing ever.
I know.
Like, if we can be honest, I spent more money buying better things, quote unquote. No.
It's just switching back and forth. It just endlessly circles. All right. So what was the question? One more time.
Where's the biggest is a modified natural FET better or a fully medicated FET, and why?
No, you should never do fully medicated. Fully medicated has the highest chance of failure and the highest chance of miscarriage. No one should be doing fully medicated unless you're truly menopausal. Everybody else, no. I need to sit there for a minute and just play with that. There's got to be some, something that turns off the auto. There has to be. I don't know what it is, but.
If this continues, I'm going to lose my mind.
All right, next.
Dr. B, hi. If in early menopause, can someone open it then? They wrote it again. When can we start trying after an ectopic pregnancy? No tubes were lost. Methotrexate was used.
3 months after the methotrexate, assuming that your HCG has gone down to 0 and stayed there for at least a few weeks.
All right, back to Instagram for a bit. It's been going wild over here, I see. Is there any possibility of you doing testing with you in Toronto?
Yes, I have a sister clinic in Toronto, no problem.
Is severe kink reversible with surgery if HSG still shows tubes open? Do I have a chance for natural conception?
I don't know what you mean by kink. A kink in the tubes, a kink in your cervix. It could be fixable. Depends on what's causing the kink. I was transiently worried that question was going to go into some sort of pornographic detail when I got the word kink, but then you steered it straight.
I did my part.
Yeah.
I was good today.
Yeah.
How can you regulate period? I am 46.
Well, that depends on why your period's becoming irregular. If it's because you're becoming menopausal, the only way to regulate it is with hormones. If it's not becoming menopausal, then I need to see you so I can figure out what's wrong with your hormones that's causing it.
Hi, Dr. B and Dr. Z. Thoughts on intralipid therapy after 3 failed implantations?
After 3 failed implantations, I think intralipids is totally reasonable, but we would advocate for appropriate testing, microbiome, immune, stuff like that.
Dr. Victory.
Yeah.
7 weeks, taking progesterone, baby aspirin. My HCG was 6956 at 21 GPO.
Okay.
February 28th, should get my HCG checked again to make sure my levels are rising. I'm afraid of a miscarriage, 2 previous losses.
I wouldn't bother with an HCG at that stage. I'd probably just go in and get an ultrasound to make sure. If you're 6 weeks, they should see a fetal pulse and a fetal heartbeat. You should be 6 weeks by then, I think. But if you're not, then yeah, you could do another beta or a serial beta.
What meds do you give any natural FET?
Progesterone. Just progesterone. Double, but just progesterone if it's pure natural.
Had an ERA.
Oh, God.
Emma and Alex.
Yeah.
Biopsy done 29 days ago.
Yeah.
And still haven't gotten a period since all came back normal. Of course, but no period. I'm usually very regular.
Do a pregnancy test. The biopsy could have made you sticky enough that it worked. So go get a preg test. And if not, get your hormones checked.
Dr. V, just
there's nothing on the screen, dude.
Oh, what the? It's just one of those days.
We lost the battery.
Why not?
I'm still here, folks, but the battery died. Maybe that's why it kept conking out on us.
What would that? That's just so absurd. One second. I think I must have left it on when we ate. Okay, they're coming back. The great and wonderful Dr. Victory.
This is just like a horrible nightmare of electronic craziness. All right, there you are. And now you're off camera. Are we putting it on me until it charges?
Sure.
Oh, boy.
That's right.
Well, I'm going to look this way. So just put it that way and it'll get both of us.
Oh, super wide out?
Yeah, just get it for both of us. Yeah, you got us both in there.
Okay.
A little bit of you.
You know what? It won't be good for the Instagrammers because they only have a.
All right.
So don't worry.
Okay.
They love you.
How long will it take for this one to turn on?
It's probably on now. Anyway, let's not worry about that.
All right. Next question.
They can hear me. We'll go to TikTok since they can still see you. I have 8 good quality eggs frozen now. 41. What are my chances?
You froze 8 eggs at 41. Unfortunately, your chances would be very low. You need about 40 at 40 to get 1 baby. So 8 is just going to give you not a ton of chance.
Just started at your clinic getting blood work and transvaginal ultrasound.
Yep.
What are you looking for?
Your hormones, how high your estrogen goes, when your LH starts to spike. What's your thyroid like? How high is your AMH, your vitamins? Antral follicle count. How does your lining develop? What position is your uterus in? Are there cysts, endo, adeno?
It's strange that it's not switching now, right?
That was running out of charge, and that's how it was
So
telling
tripping it
us.
out, you
It
think?
was tripping it out. Yeah. Any hope?
Yeah,
All right. Do you want me to turn this one back on
No,
you?
no, just
All right.
so.
Ask a question and then I'll
Yeah.
answer while you adjust.
If endo is outside the uterus, why does it impact implantation?
Because it causes inflammation, and that inflammation is systemic, and that goes everywhere in your pelvis, locally and throughout your body. So your cytokines are up, your natural killer cells are up. It alters the endometrial receptivity. All of that stuff is impacted. All of it.
And you're
And I'm gone. That's really weird. We got to figure that out.
Could a bad lab cause recurrent FETs and chemical pregnancies?
Yes, if they didn't handle your embryos well, or there's an infection in the lab. Yeah, of course. Or they mishandled the embryos.
Listen to this one. Which years ago could have saved myself a lot of heartache?
Oh, I'm sorry. I wish you could have too.
Lost my baby January 25
Oh gosh, I'm so sorry.
due to skeletal dysplasia of the chest.
Oh,
Could my other embryo, can my
Picture.
other embryo carry this?
yes. And you should get genetic testing done before you do anything so that you make sure it's not a dominant condition that you could have passed to a lot of your embryos.
My daughter has had 7 transfers. Doctors here in Edmonton say everything is normal.
That's not possible.
Yeah, let's just be honest, right?
Let's just call it what it is. That's not possible.
Could a bad lab, we read that. What's going on?
It's going to 3 in 1 second. It
You
just
mentioned-
cycles. It goes 1, 2, 3.
You mentioned with low AMH would do multiple. Can AMH grow? And if it does, would that change outcomes?
Your AMH won't rise significantly enough to make a difference pretty much no matter what you do. You'll get a little bit of a bump with certain treatments, but not a lot. You're talking about adding a couple of eggs each time.
Hello, lovely gents. Can a 7 centimeter intramural sub
Yes,
serosal
absolutely.
fibroid
It'll,
impact
yes,
outcomes?
yes,
Yes.
yeah.
I hope so.
At 7 centimeters, it's going to cause some distortion of the endometrial function, and that's proven in studies. So if it's intramural at 7 centimeters, you got to get it taken out. It's just too big.
What immune tests do you do for recurrent miscarriages?
Immune,
Mhm.
NK cells, NK cytotoxicity, cytokines, T regulatory cells, DQ alpha, LAD levels, KIR testing, lots of stuff.
14% NKC,
Okay.
endo and adno,
Okay.
44 years old,
Okay.
14 AMH.
Oh, wow. Impressive.
Do I have a chance?
Absolutely.
4 miscarriages.
You totally have a chance. You need a lot of help. You need our endo protocol. You may need surgery. And you need PGT testing because the majority of your embryos will be genetically abnormal. But if you get a genetically normal embryo, I can give you a very reasonable chance.
We'll end it with this one. You'll like this one.
Okay.
By liking means you won't like it.
Oh, all right.
I did a receptive test.
A receptiva test.
That's right. Prior to doing a laparoscopy of endo. And I was receptive. Would my receptivity change after surgery?
They did a receptivity test
Yeah.
prior to doing laparoscopy. Would it change? Well, that depends on whether or not you believe those tests. I don't believe those tests. So no, I doubt it. Yeah, no. It's hard to know because none of those tests have been proven to have any value whatsoever. Not a single one.
I got 2 euploids at 40.9, day 5, 4BA, day 7, 4BB. What are my chances? I'm going to assume.
You know what? I answered that one on Instagram
Oh, you read that
earlier
before?
today. Yeah,
Oh, okay.
yeah. The day 5 has a very reasonable chance. The day 7, according to the literature, is about 15%, 1.5.
I'll take one right off TikTok here because I know you got to.
You're on blank again.
Oh, I love it. Age 31.
Okay.
2 egg retrievals with 0 embryos, only have 1 ovary, no tubes, and I have endometriosis.
What to do?
I assume, yeah, what to do.
So she did 2 egg retrievals. She got 0 embryos, and there's only 1 ovary and bad endo.
And no tubes.
Contact me. That's a tough case, but I mean, those are cases where, unfortunately, just in fairness to you, we have to discuss donor egg.
With the PA speeding things up.
Yeah. It should get down to a month after about 2 months from now, if I've calculated correctly, maybe even faster.
And do you recommend ablation or excision surgery for endo?
It depends on the type of endo. Superficial endo makes no difference. So you can ablate or you can excise, although we typically will excise. But deep infiltrating endo, you have to excise. Endometriomas, you have to excise. So it depends on what kind of endo.
Cutie patooties.
Oh, wow.
How much does a lit round cost at your clinic?
1,100 per round.
902.
That's it. This show is getting annoying because the device is just killing us. Okay, guys, have a wonderful night. Thank you for joining us. Huge shout out to Steph, who has joined us. She's amazing. I love her. And we will be back next week.
Tuesday, right?
Tuesday. Yes, we will be back next week. And then I'm off to Ireland. Excuse me. I'm off to Ireland for the Future Fertility Show. Yeah. Have a great night, everybody. I wish you all the best in the week to come. Enjoy the nice weather. Although, you know what? It was when I went out to grab our dinner, it was freezing outside.
What? I don't even have a jacket.
Freezing outside. It's like really cold.
No,
like,
that's not the way it goes.
I know it was cold. You didn't bring a jacket?
No, I was sweating.
I knew it could turn like that. So, all right. Have a good night, everyone. We will see you again soon. Make sure you get your uterus checked and make sure your doctor actually shows you the image like we do here and actually goes over the image with you. Have a good night, guys. We'll talk to you soon. Bye. Please tell me it wasn't that thing,
I sure hope not.
because that would be bloody awful.
Right?